Good evening, guys. I have your B for you. We're discussing older adults show hidden infection signs that may look like normal aging. So here we go with the explanation. Please join me for discussion B. Here we go. Older adults show hidden infection signs that may look like normal aging. The kind of explanation that doesn't just clarify the sentence but opens up the whole landscape of what's happening biologically, behaviorally, and clinically. What the sentence really what the sentence is really pointing to. It describes one of the most important and most misunderstood truths in geriatric care. As people age, the body stops broadcasting illness in obvious ways. Instead of fever, sharp pain, or dramatic symptoms, infections show up as quiet shifts in behavior, energy, or cognition. To families, these changes look like she's just slowing down. He's having an off day. That's just aging. But to clinicians and experienced caregivers, these subtle shifts are often the first and clearest signs of infections. This mismatch between what the body is doing and what people expect illness to look like is exactly what the page is warning about. Why infections become silent with age. Aging changes the immune system, the brain and body's signaling pathways. The result is a muted, almost whisper like response to illness. The immune system gets quieter through a process called immunoscience. The aging immune system loses some of its ability to mount a strong inflammatory response. That means fever may be absent, pain may be minimal, swelling and redness may be subtle. The body's alarm system becomes unreliable. A younger adult's body shouts, an older adult's body murmurs. Fever becomes an unreliable indicator. Many older adults cannot generate a fever even with a serious infection. A temperature of 99 may represent a major internal battle. This is why no fever does not mean no infection. The brain becomes more sensitive to stress. Even mild infections can disrupt brain function in older adults, especially those with dementia or mild cognitive impairment. This leads to sudden confusion, aggression or agitation, hallucinations, or withdrawal. These symptoms look like psychiatric or behavioral, but they're often medical. Energy and mobility decline first because the body is diverting resources to fight infection. Older adults often show weakness, slower walking, increased falls. Needing more help with daily tasks. These changes can appear days before any classic infection symptoms, the hidden signs that mimic normal aging. These are the subtle cues the MSN page is highlighting, changes that families often dismiss but clinicians treat as red flags. Cognitive and behavior changes, sudden confusion or disorientation, new agitation, irritability or restlessness, excessive sleeping, withdrawal from conversation or activities, not acting like themselves, functional changes, new difficulty walking, increased falls, needing more help with dressing, bathing, or eating, loss of appetite, not drinking enough, new incontinence or bathroom accidents, physical changes, mild cough, silent shortness of breath, or slight shortness of breath, vague abdominal discomfort, subtle chills, a small temperature rise. These signs can indicate UTIs, pneumonia, flu, COVID, skin infections, or even early sepsis. Even when the person insists they feel fine. Why this matters so much? Because the signs are subtle. Infections in older adults are caught later, more likely to become severe, more likely caused by delirium. More likely to lead to hospitalization, more likely to trigger long-term functional decline. A small, easy, treatable infection can snowball into crisis if the early signs are missed. This is why geriatric clinicians teach a simple rule. Any sudden changes in behavior, cognition, or function in older adults should be treated as a possible infection until proven otherwise. A myth busting slide for your presentations. A short script for a video or podcast. a comparison chart, normal aging versus infection signs, or one-page handout for families and staff. Just tell me what format you'd like to build next. Okay, guys, here's the second half of B for you. Okay, early infections in older adults rarely look textbook. The art of early recognition makes the case that clinicians and caregivers must treat any sudden change in cognition, appetite, mobility, or behavior as a possible infection, even when fever or pain is absent. This is especially relevant in communities like Pennsylvania, where many older adults receive care in long-term care settings, and subtle changes can easily be missed.
I know it's crazy.
Why infections look different in older adults. The article highlights a central truth. Aging biology reshapes the immune response. Immune senses chronic disease and medications like beta blockers or steroids blunt classic signs such as fever, tachycardia, or localized pain. As a result, confusion or delirium may be the first and only sign of infection. Falls, weakness, or new difficulty walking can signal early pneumonia or a UTI. Loss of appetite or withdrawal may reflect systematic inflammation rather than just aging. Stroke-like symptoms can appear in sepsis due to altered perfusion or metabolic shifts. The mismatch between pathology and presentation is why the authors call early recognition an art. It requires pattern recognition, baseline knowledge, and vigilance. What the article emphasizes most: atypical presentation are the norm, not the exception. Older adults often lack fever, elevated white counts, or focal symptoms. The article stresses that non-specific symptoms should trigger evaluation, not dismissal. Baseline matters more than any single vital sign. Knowing a person's usual cognition, mobility, appetite, and sleep patterns allows caregivers to detect subtle but meaningful changes. A small shift may be clinically huge. Early testing prevents uh, deterioration. Because deterioration can be rapid, the authors recommend a low threshold for labs and imaging, especially for urinary tract infections, pneumonia, soft skin soft tissue infections, gastrointestinal infections, antibiotic stewardship may still matters. The article balances urgency with caution.
Maybe you take something where the
With caution, start empathetically therapy when warranted, but de-escalate promptly once cultures return to avoid resistance. An especially important issue in communal living environments. Practical takeaway for clinicians and caregivers. For clinicians, interpret visits or interpret vitals differently. Temperature of 99 Fahrenheit may represent a fever if baseline is 97. Use composite assessment, combine functional changes, vitals, and labs rather than relying on any single indicator. Reassess frequently. Older adults can decline quickly. Early follow up is essential for long term care teams. Implement a daily change in condition checklist, cognition, mobility, appetite, continence, behavior. Train staff to escalate concerns early. Something is off. Is clinically meaningful. Maintain a facility antibio program to guide empathetic therapy. For family caregivers, watch for subtle shifts. Sleeping more, eating less, seemingly not themselves. No moving differently. Uh, report changes promptly. Early evaluation can prevent hospitalization. Okay, guys, that is your B for the evening. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.